My name is Sara Labban, and I'll be discussing about the icon resin infiltration technique. To begin with, what is a white lesion? A lesion is a white spot that's appeared on the surface of the teeth. It can be seen by our naked eye on the anterior teeth or the posterior teeth. Over the last decade, it has been noted that there's an increasing incidence of white marks on erupting teeth. Some of this is due to a condition called the molar incisor hypoplasia, where both erupting incisors and first molar have white spots. We also have other causes that leads to the white lesion, such as poor oral hygiene, eating acidic or sugary food, and dental fluorosis. How can we treat this? Normally, the only way to treat the lesion is by numbing a patient with a shot and drilling away the tooth structure to access the cavity. And then the cavity is filled. Sometimes when the cavity is at the proximal surface, drilling is stressful and painful for the patient. And in case the cavity was small and at the proximal surface, the dentist will drill healthy structure of the enamel to get access to this cavity. Also, we should mention that the drilling is very dangerous. In order to replace the drilling technique, the resin infiltration is applied. The resin infiltration technique doesn't require drilling and it fixes the cavity of the dental caries, and it requires no shots of anesthesia. Resin infiltration is a new treatment to treat small cavities between the teeth, which is mostly on the proximal surface. Resin infiltration allows the dentist to slide a plastic perforated sheath in the teeth. The treatment is used when there is a white or early lesions in the enamel, and in order not to drill the healthy enamel to get the access to this cavity. Again, this treatment allows no drilling and filling of the cavity. Its component. We have the icon H, which contains the hydrochloric acid, pyrogen silicic acid, and surface active substances. Second, we have the icon dry, which contains 99% of ethanol, and the icon infiltrate, which is methacrylate-based resin matrix alongside with initiators and additives. How is it applied? First, we need an isolation. A good isolation is essential as the initial phase uses a strong acid for etching the tooth. And then, this is done by a rubber dam. Preparing the surface by cleaning it with a gel is the next step, which contains 15% of HCl that prepares the cavity for the resin infiltration. We wash the gel, alcohol is applied for 2 minutes, and the tooth is filled then with a liquid resin which has a low viscosity. This resin is tegma resin, which is triethylene glycol dimethacrylate, and is applied through a perforated sheath for 2 to 5 minutes. And lastly, we light cure the area for 40 seconds. Sometimes sandblasting is needed before applying the resin for the penetration step. As we can see before the icon, we have a white spots appearing on the surface. And after the icon, the appearance has improved and the white spots have disappeared. How does it work? With the onset of caries, cariogenic acid attacks the enamel and draws out the minerals. After the treatment with icon, the pore system is closed, blocking the progression of caries. Its costs. The icon costs only $160, and it comes with a smooth surface tip and a proximal tip, which is very cheap with comparison to the old treatment, which requires a drill and requires a filling, which might exceed the cost of it for $700. Advantages of icon resin infiltration. It is FDA approved, it's commercially available, it doesn't require any anesthesia, and it doesn't require drilling, which might be very relieving for the patient. And it has an aesthetic results on the smooth surface, and not to forget that it is only requires one quick visit to the dentist. Its disadvantage is that it can't be applied on a late stage of caries. Thank you.